Hi guys, and welcome to today's Vlogmas video. I'm obviously filming in a different spot in front of my Christmas tree. I decided to switch things up. My whole house is empty today. It's just me here, so I figured I could use this time to film in front of the tree and not bug my family, because the tree is like dead center in our living room and the TV's here and the couches are here. So normally I can't film here because that'd be really annoying. Today's video is gonna be all about, I don't know if you can see my shirt, clinical. I don't know if you can read that, but my shirt says eat, sleep, clinical, repeat, hashtag nursing student on the bottom. And I felt like it was a good shirt to wear for this video. So today I'm going to be talking about clinicals, what to expect with clinicals, what clinicals are like, the whole thing. This is a video that was requested by someone who follows me on Instagram. I will put her name right here. Thanks so much for following me, following my YouTube channel, subscribing to my channel, and requesting this video, because without you I may never have thought to make this video. I'm really glad you requested it and that I'm now filming this, because this is definitely information that I would have loved to have had before I went to clinical. Going to clinical for the first time is super scary, so I feel like this will be informative and kind of helpful for you and anybody else who's just curious about clinicals, what they are, what you do, that whole thing. Before we start the video, if you guys have not, you should subscribe to my channel. I'll try and put like a button down here that you can click to subscribe, but you should totally do that. It's free, and all it does is notify you guys whenever I post a video. You just get a little notification and then you can go watch it, and that's about it. But yeah, so if you haven't subscribed, subscribe to this channel. And then if you have any videos you want to see, feel free to comment them down below and let me know, or follow me on Instagram. I'll put my Instagram name up here. If you don't follow me there already, you totally should. And then you can request videos there too. I get messages all the time for requests. You can message me, comment on my pictures, comment on my YouTube channel, whatever you want, to get in contact with me to let me know what y'all want to see, because I've said this before and I'll say it again, the only reason for this channel is for you guys. I'm not going to make videos that y'all don't want to see. The whole point is to help you guys, to help pre-nursing students, anybody who has any questions, concerns, fears going into nursing school, or is in nursing school already and just needs some help. So if there's anything you guys want to see, let me know, because this channel's all for you guys. If you don't know what clinical is, I guess I should have said this at the beginning. So I will insert like a definition of what clinical is if I can find one, like right here. But in my opinion, clinical is where you go to a hospital, and for my school, we were each assigned a nurse for the day that was on shift, and we literally just followed her around all day. For the clinical setting that I'm in right now, it is a observation clinical only, since we haven't taken, since we haven't taken pharmacology or anything like that yet involving medication. We can't pass meds, we can't give meds, like I can't even give a cough drop, I can't touch meds, like nothing. It's strictly observation. So literally all I did all day was follow my nurse around, ask her any questions I had, look at patients. That was it. Like, we don't do a lot. We literally just observe, and I won't be able to do more, not this coming semester, the spring semester, but next fall, because the spring semester I'm taking pharmacology, and after I take pharm, we can have a clinical where we actually like help give meds and look up meds and stuff like that. So right now it's strictly observation. So every Tuesday was my clinical shift, and I would get there at 6 a.m. They're super early. Most hospitals, you start when the nurses start, and so I was getting there for a shift of nurses that were starting at 7 a.m. and went from 7 a.m. to 7 p.m. We didn't stay till 7 p.m., but we start when they start. So if your hospital, like the shift starts at 5:30, you gotta be there when the nurses start. So we would show up at 6 or 6:30. We had to be there by 6:30, but usually I got there around 6 because I'm terrified of being late, because the rule for our clinical setting was if you're late at like even by like 30 seconds, whatever, they shut the doors and they don't let you in, and that's it. And you miss the day and you have to make it up later on your free time, which is a bummer. So I was super paranoid about being late, so I was always there very early. At 6:30, our little group of students, we were split up into groups that were assigned to different hospitals, because there were so many, like there's so many students, not all of you can go to one hospital. So my class, there's only 10 of us. We were split up into two groups, which 10 is small if you don't know that. For nursing school, that's tiny. So there were 10 of us. We were split up into two different groups. 5 of us went to one hospital, 5 of us went to another hospital. So I can only talk about what happened at on my shift with my group. I don't know about the girls at the other group. So we showed up, we had to be there by 6:30. Our little group of 5 would meet up, and then we'd meet with our clinical instructor. Our clinical instructor is someone that is slightly associated with our school, but she's an actual nurse. So she's just helping our school by being a clinical instructor, and all that means is that one of our teachers doesn't have to come and be with us all day. It's an actual nurse that likes to teach, and so what she does is she just watches us all day. If we have questions, we go to her. She kind of just sticks with us, like keeps track of us throughout the day in the hospital, so we're not doing anything wonky. But yeah, she's not an actual teacher. She is a nurse, at least mine was. I'm assuming most clinical instructors are also going to be nurses, but that could be different depending on the school. So my clinical instructor, we would meet with her in our little group, and we would have what's called pre-conference. Now I'm pretty sure all nursing schools have this, but I could be wrong. So pre-conference is where you just meet up as a group. You get assigned your nurse, some schools assign patients. I know the girls at the other hospital from my school were assigned patients. We weren't. That's kind of up to your clinical instructor. We got to choose our patients based on who our nurse was caring for that day. So we would get assigned our nurse, and we would just be kind of told, like, this is your nurse, this is who you're meeting with, and then we would go up to the floor. Some schools do pre-conference a little bit longer because if you're assigned a patient, you kind of are able to read up on them before the shift, learn a little bit about your patient before you go onto the floor. So we would just get assigned our nurse, go up to the floor, we kind of wait for the nurses to show up, and then you go to your nurse, you introduce yourself, you kind of tell the nurse who you are, what you're doing there, what you're able to do and not able to do, and you just go from there. My shift would start, some days we would be assigned our nurse, some days we got to pick our nurse, some days we'd be assigned a patient, some days we'd get to pick our patient. It kind of just varied on what my clinical instructor wanted us to do that day. Almost always I'd go to my nurse and she would meet with the nurse from the night shift. So we're starting in the morning. She'd find the nurse that had her patients from the night shift and say, hey, tell me what happened to this patient throughout the night. And that is called giving report. So the night nurse will give report to the day nurse, and then the day nurse will kind of take over from there until the night comes back, and it kind of just goes on a cycle. I would follow my nurse around for a report and listen to, normally we had between 3 and 5 patients. I would just follow her around, listen to everything that the night nurse said, and then from there I would pick a patient and say I chose room 207. I'm going to go into the chart, which is online in a system, at least my school is. We use a system called Epic, which is like just basically a software program website thing that keeps track of all the patients on the unit. And so I go in and find patient in room 207 and I'd start writing information on them. And that's where this piece of paper comes in. And it's just getting information like what's their height, weight, age, are they a fall risk, are they alert and oriented, what were they admitted for, do they have allergies, just kind of all their information. And we'd pick one. I don't know how other schools do it, but our school, we'd pick one. And then we have to fill out what's called a database. And we just do this kind of throughout the day. If my nurse was taking a break and didn't really have a whole lot going on, I'd go find a computer and fill out my database as much as I could. If it was a busy day, I'd kind of wait till after lunch. So for the most part, I was following my nurse around literally the entire time until about like 11:30, 12. Then my clinical instructor would kind of come around and ask how things were, if it was okay to take a break, and then I'd ask my nurse, is it all right if I go to lunch? And she'd say, yeah, that's totally fine. And then me and my group of students and my clinical instructor would all go down to the cafeteria. We'd have lunch for about an hour. We kind of just chit chat about how the day was going. We'd go back upstairs probably by like 1 o'clock, and then we'd continue the shift from 1 until 3. We were done at 3, and then we have post-conference after that. So usually if it was a super busy morning up until lunchtime, I would take from 1 to 3 to fill out my database. So our databases are 14 pages long. I don't know how other schools do this. I don't know if this is required for other schools. I'm not really sure. But what a database is also called clinical paperwork for other schools. For us, what we had to do is write down essentially all the information about our patient. So why were they brought in? What are their signs and symptoms? We had to do a full head-to-toe assessment on them. So looking from head to toe, what's their skin condition look like? What's their pulses like? What do their lungs sound like? What's their heart sound like? What do their bowel sounds, their abdomen sound like? Do they have any deformities? Things like that. We had to document all of it. Then we had to go in and document, okay, now let's look at their labs. So what does their white blood cell count look like? What do their hemoglobin look like? All that stuff. So all their labs, any abnormal labs. Then we had to write down all the medications they were taking. We only had to do 4 because some patients are on a lot of medications. So they don't want you to write all of them down. But we had to write down the medication that they were getting, how much, talk about their IV site, what it looked like, what medication they're getting through an IV, what's their nutrition like, are they able to eat normally or do they have a feeding tube, all sorts of details. And I kind of condensed that 14-page database down into this little piece of paper because a lot of the girls from my school brought the entire 14-page thing every week to clinical, and I could not do that. I don't have enough printer ink for that. I couldn't. So I wrote it out, wrote out all the information and left blank spaces for what I needed to write, and I just fill it in. So I have admitting diagnosis, allergies, past medical history, past surgical history, what's their IV site look like, what are their vital signs, what's their input and output, what's their daily hygiene been like, their skin condition, what are their labs, what are their meds, have they had any surgeries today, or have they had any radiography today, which is like imaging. So all sorts of stuff I condensed into this tiny piece of paper because I was way too lazy to carry around 14 pages of paper. I didn't want to do that. So then I'd come home, So I'd fill out this paper, usually between 1 and 3, get it all the information I need written down, which some days, I wouldn't only be able to fit it in this paper. I'd be taking up, 2 or 3 of these pieces of paper. It just depends because, if I have a patient that has a longer medical history, that's going to take more room to write on my paper. So I followed this as much as I could, just so I didn't forget things. I didn't want to forget to write down their medications because I'd miss that in the database later. So I tried to write down as much as I could. That was about it from 6 in the morning till 3 in the afternoon. I literally just followed the nurse around. That's it. We weren't allowed to do a whole lot of anything. Now, I will make an updated clinical video this time next year, at the end of my fall semester next year, because that's going to be different. I can give medications then. I can help with go get medications then. There's a lot more that I can do. Opposed to now, it's really all we were doing was a head-to-toe assessment, writing down what we find, checking vital signs. If the patient needed a blanket, I could go get them a blanket. If they needed a cup of water, I could go get them a cup of water. But there wasn't a whole lot we could do because we can't give medication or anything like that. So that's about all I did from 6 to 3. And then from 3 to about 4 o'clock, we had post-conference, which is where each of us as a student would go through and basically read this entire thing and give a report to our other classmates about our patient. Now, we all were assigned different patients, so it was kind of pretending okay, it's the end of your shift and the night nurse is coming. What all is the information you want to tell her about this patient before she takes on the role of their nurse for the evening? So that's what we did. We kind of pretended we were nurses giving report to each other, and we'd just go over this. It would take about an hour, and then our shift was done. So then I'd come home and I'd start filling out that 14-page database. And all I would do, ours is completely online, so I would just type in all this information that I wrote down, which this day I had a pretty easy patient, so that's why it only took 1 page. But like I said, normally I have the back filled out, I have a couple of pages filled out, just depending on how long their past medical history was, past surgeries, medications, things like that. So that would take me a couple hours to fill out just because it's a lot more detailed. So here I have their labs written out, but I have to say okay, their white blood cell count was really high, and then you have to give a reason for why you think that lab is the way it is. So that would take me longer. I'd have to talk about their medication and what the expected response is by the patient, what the nurse needs to do before she gives the medication. So if she's giving a blood pressure medication, she needs to check their blood pressure before she gives it, things like that. And then at the end, we had to journal and just talk about our day and kind of how we were feeling about it and stuff like that. So that's how my clinical experience went. All I really did for clinical. My clinical was different than most students because most students don't start their clinical rotations until they're already done with pharmacology, and that's because you're able to give medications. Now, for us, all we were able to do is observe, so our clinical was a little bit more boring, I guess you could say. Not boring, but it's hard because you don't feel you're very helpful to the nurse. You kind of feel all you're doing is being her shadow, following her around all day and asking random questions. It was a great experience. I loved being in the hospital. I loved seeing patients, and I loved getting to ask my nurse all sorts of questions because it was so awesome just getting to learn. But it was also hard because we didn't feel we could be very helpful to the nurses. So that was my clinical experience. I hope that helps you know a little bit more of what to expect. For the most part, if you're in a clinical setting like me where you can't give medication, you're really just going to be following the patient around, the nurse around. Sometimes you'll get assigned one specific patient and you'll just sit and hang out with that patient all day, kind of just talk to them, do a head-to-toe assessment, whatever. I tried to stick with my nurse more and just follow her around. It's kind of up to you though, because there were girls at my school that they'd pick their patient and they'd stay with him all day, and they'd sit and talk with him, and if he needed water, they'd go get him water, they'd check his vitals every now and again, they'd do a head-to-toe assessment, and they'd stay with that one patient. I wasn't really like that. I stay with my nurse more because I felt like I was gonna get more exposure to things if I just followed her around to all of her patients instead of sticking with this one person. So that's the way I did it. It's kind of up to you. You know, if nothing's going on with your one patient, ask your nurse, like, hey, do you mind if I just follow you around to the other patients because not a lot's going on with this guy? And she'll probably say yes. Like, you know, the more exposure you can get, you should. This is your opportunity to learn. This is your opportunity to be in the hospital and experience as much as you can. So if someone's going down to the cath lab to get a stress test done on their heart, or they're going to, I don't know, GI to get a colonoscopy done or something like that, that is your nurse's patient, ask your nurse, hey, can I go down and watch that colonoscopy be done? Can I go down and watch that stress test be done? And they'll say yeah. They'll be like, go, have fun. Like, it's your learning experience, and learn as much as you can. That's the whole point. So I hope you found this video helpful, especially to the girl who requested it. I'm sorry, I don't know your name, but I know your Instagram name, which is funny. But thank you so much for requesting this video. I really hope you found this helpful. And if anybody else found this helpful, I'm so happy. If you guys have any questions, or there's anything like you're confused on that I didn't really explain properly, comment down below and I'll be happy to answer those for you. I really hope you guys enjoyed this video. If you did, give it a thumbs up. If you have any videos you want to see, comment them down below, or follow me on Instagram. My dog's about to walk in front of the camera. Daisy, go. If there are any videos you guys want to see, let me know. No, sit down. You're Daisy. You're right in front. Lay down. You're right in front of the camera. Oh my goodness. Like I said, be sure to subscribe. Give this video a thumbs up if you guys liked it. And I'll talk to you guys next time.